Welcome back, registered nurse to be. In this second video of the series, I'm going to introduce you to 3 standardized nursing languages that nurses in various settings use to document their care. Some of you might be here because I directed you to this video, others might have just happened upon it. However you got here, welcome, and I hope you leave informed. In this video, I'll go into a detailed description of 3 standardized nursing languages. Through these descriptions, you will begin to be able to discuss the importance of using standardized terminologies in nursing documentation, and you'll begin to be able to explain the benefits of standardized nursing languages. I've broken this topic down into several parts, so watch the other videos for content related to the other objectives for this topic. On a continuous basis, nurses document their assessment of their patients, the nursing diagnosis they formulated for these patients. Nurses also document the outcomes they want the patient to achieve and the actions they carry out, whether independently or collaboratively with other healthcare providers, and the patient's response to these actions. This ongoing process of assessment, diagnosing, intervening, and reassessing is called the nursing process. Although there are no standardized nursing languages to document patient assessments, I will describe standardized nursing languages used to document nursing diagnosis, patient outcomes, and interventions. The first standardized language that we're going to discuss is NANDA I. You may also hear it being referred to as just NANDA. NANDA contains standardized terms referred to as diagnostic labels, which can assist nurses in various settings to document the nursing diagnosis they formulate. Nursing diagnoses can be written for individuals, families, or communities. Simply put, these diagnoses represent problems that are occurring or problems that are at risk for occurring. Because there are over 200 individual diagnostic labels to describe problems that a nurse can diagnose, NANDA had the labels organized in a hierarchy beginning with 13 domains, 47 classes, then the over 200 diagnostic labels. To ensure that the diagnostic labels are being used correctly, each has a definition and defining characteristics. Each diagnostic label also has a unique numerical code. In this example, nutrition represents the domain in which there are classes of diagnostic labels. All the diagnostic labels in the ingestion class represents diagnoses that can be written for patients with problems with ingestion. Likewise, the diagnostic labels in the hydration class represents diagnoses that can be written for patients with problems with hydration. This hierarchy exists to provide organization to a comprehensive set of diagnostic labels. Let's take a closer look at the diagnostic label called deficient fluid volume. Notice that the domain, class, and diagnostic code are indicated at the top of the reference page. This unique diagnostic code could be very useful when these diagnostic labels are used to document nursing diagnoses in a nursing information system, since computers recognize numbers, not words. The definition of the diagnostic label is much like the definition of a word you would look up in an English dictionary. The definition tells you what the diagnostic label is referring to. This definition is very important to ensure uniformity in use, since some of the diagnostic labels sound like words you would put together in your day-to-day communication and which could be interpreted differently. The defining characteristics are those signs and symptoms which the patient must exhibit before the nurse can use the diagnostic label to diagnose the patient. In the same way, the doctor compares a patient's signs and symptoms to formulate a medical diagnosis which allows other healthcare professionals to know what is wrong. Nurses must also match the patient's signs and symptoms to the defining characteristics to correctly diagnose the patient with the problem. When this is done, communication between nurses is enhanced as now nurses are using a commonly understood professional language rather than their day-to-day expressions, which may vary and cause confusion in communication. The explanation I just gave illustrated that one of the benefits of using standardized nursing languages is better communication between nurses. This happens because nurses are using a commonly understood and accepted professional language rather than their day-to-day expressions, which may vary and cause communication confusion. In the same way Jamaica has adopted the English language as its official language, NANDA can be adopted as the official language nurses in a particular hospital can use to document their patients' nursing diagnoses. When nurses are using the same standard to diagnose their patient, there is consistency in diagnosing patient problems. Nurses are no longer having to rely on their clinical judgment or gut feeling, because these can vary significantly and be very subjective. When nurses across parishes, territories, and countries are diagnosing patients using the same standards by using the same standardized nursing language, it means that we now have a basis to compare these patients. Think about it as before, we had a situation where nurses in Jamaica were speaking English and nurses in St. Vincent were speaking French. If a nurse researcher wanted to count the incidence of a problem, it would be extremely difficult since we're calling the same thing by a different name. Now think of if nurses in Jamaica and nurses in St. Vincent were speaking NANDA. Wouldn't that make the researcher's job of counting the incidence of a problem significantly easier? Place a light bulb emoji in the comments below if you had an aha moment just now. If by now you're still not convinced that there can be a great deal of variation in how nurses can refer to the same thing, let's look at this example. Nurse X assessed the patient and found that the patient is lethargic, the skin and mucous membranes in the mouth are dry, and the urine output is decreased. If other nurses saw this same assessment, one might document that the patient is suffering from dehydration. Another nurse might document that the patient is in a hypertonic state, and a third might document that the patient is experiencing execosis. All three nurses had the same data, and all three nurses came to the same conclusion that the patient is dehydrated, but they all documented it in a different way. If all three nurses used NANDA to document their patient's state, they would have all documented deficient fluid volume. In closing out this discussion on NANDA, don't forget that NANDA diagnostic labels are used to document nursing diagnoses in whatever setting a nurse is working and for whatever stage of illness or wellness a client is in. Remember too that a nurse's client can be an individual, family, or community. NANDA diagnostic labels are linked with NIC interventions and NOC outcomes. This means that NANDA can be used by itself or with NIC and NOC. We're going to go right into NIC next. The acronym NIC stands for Nursing Intervention Classification. This is the next standardized nursing language that we'll discuss. Before we get too deep into our discussion on the Nursing Intervention Classification or NIC, it's important that you understand what a nursing intervention is. According to Butcher et al. 2018, a nursing intervention is any treatment based upon clinical judgment and knowledge that a nurse performs to enhance the patient's outcomes. Simply put, it's what nurses do to make patients better. Butcher et al. Defines the NIC as a comprehensive, research-based, standardized classification of interventions that nurses perform. NIC includes interventions that nurses do on behalf of patients, independent nursing interventions, and collaborative nursing interventions, which are performed in collaboration with other healthcare providers. They continued by stating that the classifications, both NIC and NOC, were systematically developed using research methods and field testing. NIC and NOC are established classifications of nursing interventions and outcomes with over 26 years of research in multiple countries. NIC has a similar organizational structure when compared to NANDA. NIC is organized into 7 domains, 30 classes, and 565 interventions and over 1,200 nursing activities. It's important that you note that NIC can be used in a nursing information system independently or along with NANDA or NOC. Also, a nursing information system is not mandatory for using any of these standardized nursing languages. A benefit of using them in a nursing information system, though, is that the data are documented electronically, so it is more accessible. Also, you would have seen that the languages are expansive, so the information system stores the language rather than having the nurse rely on their memory of the language. Each NIC intervention has a name and a unique numeric code. Similar to the numeric code assigned to each NANDA diagnostic label, this code would be very useful for research purposes. There is also a definition of what the intervention is. This definition describes what the nurse is doing when providing the named intervention. Before I go any further, I want to highlight a benefit of standardized nursing languages, which has been brought out by what was just said. In the last video, we spoke about the unfortunate reality that the nurse's contribution to patient outcomes are invisible, and when named, they are referred to in negative terms. Remember, outcomes potentially specific to nursing? If you haven't seen that video, I'll place the link to the video in the description. By using the nursing intervention classification, there is an instant recognition and naming of exactly what the nurse has done for the patient. If we can't name it, we can't measure it. If we can't measure it, we can't research it, then we can't validate it, and we can't replicate it. These are the steps involved in research and evidence-based practice. There is more to say about how standardized nursing languages promote research and evidence-based practice. So, as the language reveals them, I will discuss them. When standardized nursing languages are used, there is an improved ability to estimate the need for nursing as a basis for planning, budgeting, and resource allocation. When we are able to demonstrate what nurses are doing using documented data, nurse managers and hospital administrators are in a better position to assign objective measures to what we do and what we need. For example, when we use NIC to document nursing interventions, we are better able to estimate how much nursing care a patient requires, since each NIC intervention is associated with an estimate of the time required to carry out each intervention. Time spent with a patient can be used as a basis for determining how ill or how well a patient is. The patient acuity is one factor when determining the allocation of nurses for a shift. The second benefit I think would be particularly advantageous for nursing students or even for an experienced nurse in a new situation. NIC takes the guesswork out of deciding on what to do for the patients, because when you choose the intervention, the activities are all there for you to select from. Also, because they are linked to NANDA, when used in a nursing information system, decision support can make suggestions of appropriate NIC interventions based on the NANDA diagnosis the nurse documented. You could even say that when standardized nursing languages are used in nursing information systems, documentation becomes more efficient. If we look back on the elements of each NIC intervention, there is a list of activities which the nurse must perform under that intervention. In the example displayed, the nurse administers supplemental electrolytes as an activity involved in electrolyte management. These activities are as a result of research. That is, if NIC lists administration of supplemental electrolytes as an activity involved in electrolyte management, it is because this action is supported by research evidence. This is another way in which using standardized nursing languages will help to promote evidence-based practice. When patients receive evidence-based care, their care is improved, so they get better faster and they suffer less adverse events. Earlier, I indicated that NIC was developed using over 26 years of research in multiple countries. The significance of this is that the effectiveness of these interventions have been studied for a significant period of time and included patients of varying demographics. This improves the likelihood of the effectiveness of each intervention. The last standardized nursing language we'll discuss in this video is the Nursing Outcome Classification, or NOC. Moorhead et al. Describes a patient outcome as a measurable individual, family, or community state, behavior, or perception that is measured along a continuum and is responsive to nursing interventions. Simply put, the patient's outcome is how the patient has responded to your nursing care. Moorhead continued by defining NOC, or Nursing Outcome Classification, as a comprehensive, standardized classification of patient, family, and community outcomes developed to evaluate the effects of interventions provided by nurses or other healthcare professionals. Simply put, the outcome classification is a standardized way of measuring and documenting how the patient has responded to your care. NOC consists of outcomes for individuals, families, and communities. NOC can be used across all clinical specialties and settings, and it is organized in a similar way when compared to NANDA and NIC. There are 7 domains, 32 classes, and 540 outcomes. Again, NOC can be used by itself either in an electronic health record or in a paper-based system of documentation, or it can be used in combination with NANDA and/or NIC. After the nurse has diagnosed the patient's problem, taken action to resolve that problem, the nurse now needs to measure and document the patient's response to the care. Following the example we have been using, the nurse used NANDA to diagnose the patient with risk for electrolyte imbalance. NIC was used to provide electrolyte management, and the nurse is now trying to determine what effect the intervention had on hydration, which is the desired outcome. Each outcome has a name and a unique numeric code. The definition explains what it means when the outcome named has been met. Each outcome has a list of indicators or criteria that the nurse will use the rating scale to measure the patient against to determine if they have met the outcome or not. For example, the nurse will assess the moisture of the membranes in the patient's mouth and measure their urine output, as favorable moisture in the mouth and good urine output are evidence-based indicators of hydration. Although NANDA, NIC, and NOC can be used independently, they are tremendously powerful when used together. In addition to the benefits highlighted earlier in this video, when all 3 are used together, nurse researchers are better able to retrieve data that are comparable and conduct research on the effectiveness of nursing interventions. For example, a nurse researcher could compare the effect of electrolyte management on one or several indicators of hydration. Researchers have used NIC and NOC to determine which interventions are more effective by looking at change in NOC outcomes after an intervention. Well, registered nurse-to-be, we've come to the end of another video. In this video, we looked very closely at NANDA, NIC, and NOC, and we explored some of the many benefits of using standardized nursing languages when documenting our care. Please feel free, comment down below if there are any questions that you might have related to the content here. If there was anything new that you learned, also feel free to make those comments below. See you in the next one.